Hello, hello, hello. Well, thanks for joining me. Again, here is the Power RN, and we're here today. We're going to be talking about my favorite subject, I guess, for a long time. So, we're back with some COVID talk, the Power RN and Nurse Life. So, just wanted to share some things with you, maybe recent updates. Nurses have been on the front lines of this COVID pandemic and the care for the patients for as long as, and even before you even knew about COVID. So nurses are working hard. Their hours are long. Their days are consecutive. I've heard of 6, 7, 8, 9, 10, 16-hour shifts in a row. But having said that, well, I think we started this COVID thing with the big burst maybe back in March or something, but it's now July. And now that the north has kind of tempered a little bit, now the Sun Belt is whacked with huge numbers of patients. Now, okay, we've got nurses. We've got nurses. Many of the nurses who were from the southern areas went to the north, as we'll say, in early spring to help with the pandemic there. And they worked lots of hours. They spent a lot of time. And now they are experiencing the same thing in their home states. There are so many cases in Florida, Texas, South Carolina, Georgia, Arizona, and California that it is overwhelming. I mean, overwhelming. Now, there's some really strange connections that maybe some of you know and maybe you don't about COVID and what's going on with the nurses. Okay, people say, well, you have a job and great, you're making a lot of money. Now, if you're not a nurse or I fill in the blank, truck driver, bus driver, whatever, you might really not know what those folks do. But nurses, as I know, and I've been one for a long time, don't often garner the respect that we deserve. And that is the flat truth. So here we are today. Nurses are like a dozen eggs. In Florida, the governor says he's just going to order up some more nurses. What? Like they come from the refrigerated closet? Wow. There's a doctor who put a post in she's from Texas, and I'll leave that there, that, she thought that they needed, in her hospital, they needed more hands because, the doctors had the minds, but they needed more hands from the nurses. What? Like nurses don't have minds? But having that said, here we are months down the road. The nurses have had their own experiences in their or our own profession that folks don't know about it. But we're still out here rolling, ready to go. The nursing shortage has affected the community of nurses for years upon years upon years. The staff at almost any organization that you go to, nursing home, hospital, doctor's office, whatever it is short of nurses. We'll say we're short of nurses. That's called the nursing shortage. It's been our experience for quite some time. Now, the sickest patients in the ICU had been those patients that had one nurse to one patient. That was the norm. Then we went, to two patients to one nurse as, the shortage of nurses was affecting the organizations. And now there is an additional factor. It's the COVID factor. Nurses have four COVID patients who are on the ventilator. They have to be taken care of at least hourly, 4 patients with no other nurse assisting you. You have a respiratory therapist, the doctor comes by, does whatever they do, may help you, may not, but it's the nurse's responsibility. Well, I just saw an article in the Nursing Times a day or so ago that talks about nurses thinking of leaving their profession. And there was a survey that was completed. But the real thing is that it's just on top of where nurses have been already with nursing shortages. One of the nurse a new nurse, actually, new nurse LPN in a facility got to work, and she was told by the director and the charge nurse that she would have to take the floor with 36 patients because two people called in sick. Patients in the nursing home have COVID. Patients in the nursing home have COVID. Nurses and staff in the nursing home have COVID. Now, the rest of us that are still here are tired, and the ones who are sick because they have COVID have not been able to return to work. And there are effects from COVID that keep those nurses from coming back even after that 14-day quarantine. There are folks who can't smell, who can't walk, who can hardly breathe. And it is impossible for those folks, even if they have a negative test, which they might have at 14 days, they cannot get up and go back to work. That leaves them sick with no support, whether it's medical support, because lots of folks now are doing the health line. You're not going to the doctor's office, or you don't want to go to the hospital. The emergency rooms are full. You're staying at home, and it takes weeks, and or months to recover from COVID. But no one's told you that. The nursing shortage continues, short of staff, more and more patients, and the patients are sicker. The nurses are sick, and the nurses are tired. Now, what are we going to do with that? Because no one knows what we do. They just think nurses have hands. No one knows how we do it because the doctors say, the nurses, we just need their hands. It is impossible to get past having a full staff and a full ICU and a full ER. And oh, wait, did I say the staff was full? Oh, wait a minute. They're full, but not of RNs because, we only need their hands. We're short of RNs, so we have nurse techs and nurse aides and respiratory therapists, and they're not the same as RNs. But the nurses have had to deal with the nursing shortage for some time. So factors that affect nurses' ability to return to work, and their even thoughts about returning to work, were all there before, and now they're compounded. So it's COVID, it's short staffing, it's less pay, it's long hours, it is support from management, which can be minimal. There are managers like the young lady who was assigned the 36 patients. She didn't report that the nurse manager said that she would help her. They just told her she had to take these 36 patients. What in the world? How was that supposed to work and be effective and safe? And there's a patient safety issue, a risk management issue that's related to all of these contributing factors. The treatment that you can provide one patient is going to be definitely a concern for you when you have four patients who are critically ill. So think about that when you think about nurses. I am so invested in hoping that I can do one thing to help one nurse survive this pandemic. And my new hashtag and my new gig will be Nurses Alive Matter. Nurses have got to take care of themselves. And how can we do that when you all think we work on every floor? You think we do any old thing. $5 is enough per hour because, we have a job. Well, I don't think many of us, when we were in nursing school so long ago, or even yesterday, decided that we would put our lives on the line every day to take care of everyone else and then get sick and then be sent home on quarantine and then be told you can come back to work in 6 days, 8 days, whatever, when the manager looks at the schedule and sees that they're short and said, oh, well, Sharon's been out 8 days already, so we need her back. Well, that's not how it goes. So please consider that. I read another funny, and it's not really funny, article as well in our state where one of the summer camps had to be closed because they were short of nurses. Not one single nurse was available who had served in the camp before to take an assignment in that summer camp. And the notation said that there was, the nurses that had been there before were serving in other much more critical settings and they weren't available, and I'll use that word available, at this time. So they did not have any nurses. They had to shut down the camp for the summer. Now I wonder if these are camp nurses, eco-friendly, child-loving, friendly, happy folks, that they may have had other reasons that they didn't come back to the camp. Does anyone know the story about the summer camp that's already been on the news, that's had 82 folks there with corona and they had to close the camp down? Now, I'll just say me would not have decided to sign up for another summer camp. I would have been scared to death to sign up for a summer camp after I just read that story about the summer camp that just got shut down because the kids, yes, had corona. Now, if you don't know that kids can get corona, this is a news flash for you. So just keeping that in mind. Nurses are human. They are human. They need care. They need rest. They need food. They are excited to be available when things are looking good. We love an emergency, and that's the truth. But we need the support. We need to make sure our patients are safe. We ourselves need to be safe. We need to have the PPE. We need to have food. We need to go to the bathroom. Yes, we need to go to the bathroom. And that's the truth. So know that a nurse is not just a doll that you play with and you get out of the closet. You don't just order one and poof, they're there for you. We need to get paid. We need to be valued. And that is true. And giving ourselves time to care for ourselves and each other. Because a nurse loves the next nurse and the next nurse and the next nurse. That's kind of how we work. So keep this in mind. COVID affects us all, and nurses are not impenetrable. Even if you think we have PPE on, we have to make sure we have the right items that work the right way, that we're not now wearing a mask that in our prior lives, maybe even last year or last fall, we knew as an item that was used one time and disposed of, and you got another mask. So now we're wearing that mask, but we have to repurpose it and wear it for the next 14 days. How is that covering the nurses and protecting them? So here's my story, more about the Power RN and nurse life. Think about being a nurse and what nurses do. There's a good side, yes, and we love what we do, but we're not robots. Please give us your high five and thank us for what we are doing and our leadership groups. Please just give us your best. Make sure we have the supplies we need and encourage us to stay encouraged. I love every nurse and I love you all. Thank you, thank you, thank you for tuning in to the Power RN Nurse Life, another episode for a new week. So come on back and subscribe to me as you like, because we'll be back on YouTube. But you can also find me on Facebook and LinkedIn and Instagram. We're growing, growing, and growing. As we love each other, we love you back. Thank you. Bye bye.